Welcome to Knowledge on the Go, the podcast brought to you by the PI Programs team at Vizient. Patient transfers are routine in hospital care, but also high risk. Whether moving someone from the emergency department to the ICU or to another hospital, handoffs must be efficient. When it works, it's seamless. When it doesn't, unexpected outcomes can follow. Sharon Johnson, Executive Director, Throughput and Capacity at Community Health Network, joins us to share her experience on this topic. I'm Shannon Hale, Senior PI Program Director at Vizient, and your host. Sharon, welcome to the podcast.
Hi, Shannon. Thanks for having me.
My pleasure. Tell us a little bit about your system and what does a day look like in transfers?
We are a soon-to-be 7-hospital system in Indianapolis, Indiana. We have an entity for transfers, for acute-to-acute transfers. We handle all patients coming into our organizations that are looking for beds. We also handle our transfers out that need to go to a higher level of care, whether it's internal within our own organization or if it's to another healthcare system. A key component that we added a couple years ago is the management of ambulance transportation, understanding the need across our whole organization when it comes to discharges, patients that require ambulance to go home or to another facility. We manage those requests now for our whole system. Busy areas that run 24/7.
Great to know about your system and high volume care that you do there. I, as a nurse for X number of years, has always been an issue. And we hear it today around hospital transfers, whether it's internal or going from the emergency room to the ICU or going to another hospital. I recently read an article that spoke about sometimes a nurse may get a patient to their unit, to their department, and they didn't have all the key information that they felt they needed and that they should have had before they got that patient. Do you see that within your system, and have you addressed that and found anything that's working?
I lead our throughput work for our network. So I have the pleasure of working very closely with each one of our facilities with their throughput initiatives. Not one hospital is the same. You may see a little variance in what that looks like. One of the things that we focused on in 2025 is educating our nursing teams on transfers. Whether it's internal transfers within your own building from floor to floor, going to a hospital that's within your system, or going to a hospital with outside the system. We created a policy with brief explanations for our nurses to understand what that process looks like. What's important about that? What's the process that has to happen? Getting the order from the physician, getting the important information. Who's going to be responsible to provide that handoff information? We also did what our internal learning module for our teams to step them through each process when it comes to transfers to cover all three of those bases, internal transfers within our network and then external to another hospital. The other key component is establishing your means of communication. Utilizing your EMR, all the information for your patients are right there. We sometimes overlook that big picture of, hey, everything I need to know about my patient is right here. I would recommend people looking to see what tools they have within their EMR for handoff tools. One of the things that we do in the transfer center for going to another healthcare system or another hospital is ensuring that we're connecting those nurses to make sure that they have that handoff conversation. Even within our own organization, we ensure that that happens through the transfer center. We know there's a lot of information that could be missed if we don't have that initial conversation, trying to connect those teams together so they can have that conversation. We also have a hospital that does a 20/20 rule where they'll wait 20 minutes and then they're coming up with a patient so that there's not delay in getting the patient transferred because you're waiting on that communication, but also too, hey, I'm coming, so we're going to be right here at bedside so we can have that conversation together.
I love that. That's so innovative. Something that you mentioned made me have a flashback to when I was a nurse in the hospital. We had policies around transfers, but I love the idea of having a module that I, as a bedside nurse or a provider, other clinicians can look at, because that not only gives me information about the policy, but it also tells me, hey, the policy's out there.
It gives us better adherence to those policies to put that on their learning, and they'll do that yearly. You get turnover and things change, but still the foundation is there.
Doing it every year annually is so important. We've seen that recently with some of our sepsis work. Educating providers, educating nurses, all those people that have their hands in whenever we're working with a septic patient. It's one thing to educate me on sepsis when I'm hired, but it's that ongoing education that a lot of organizations have found is really helpful and beneficial to them.
For us was engaging those tools. Try to pull as much information that is already there for you, because your nurses are so busy. The least amount of work that they have to do and to be able to utilize the systems that you're using every day that has all that information to the advantage makes a big difference. Communication is key, but it's also time to be able to communicate. Training people on the process, bringing more awareness around it, and then utilizing the tools that we have within our own system.
We're talking about communication. Another thing that comes up to me when we're talking about transfers is capacity, getting patients into the beds. Is that something that you've seen as an issue, and any insights that you've gotten there?
That's probably one of our biggest challenges. We're so busy. Healthcare systems have had their foot on the gas pedal since the pandemic, and that's one of our biggest challenges. So we wanted to have a process to where patients that were coming into our organization were getting timely bed placement. We had to develop something to ensure that the people coming outside of our organization or even internal amongst our facilities had a process. We worked to establish our own internal triage process. Much like an ER, when you walk into the ED, they're assigning you a triage level. We're also doing that with incoming patients to bring awareness to the building, like, hey, this patient needs a bed right now. They cannot wait. They're high procedure. Something needs to happen for them right in this moment. We just did 5 different tiers for those patients or triage. That way, the hospitalist that's taking on the care of the patient and the house supervisor of the building can know we've got this incoming transfer that needs a bed right now. So I need to place them over my patients waiting in the ED or my PACU patients that are coming out. It's important to look at all people needing beds. So sometimes we get very focused on just our emergency department because everybody needs to relieve their EDs. But you also have these other avenues of patients that need beds. Your patients that are coming out of surgery, your patients that are coming from another organization, or patients that are waiting at home that was in a doctor's office that are now at home waiting and they're not getting any care. There's nobody that has eyes on them. How do we make this better? How do we bring more awareness for these patients to get them beds placed? That is something we implemented last year, and it's been helpful. We have the doctors give them a triage number. Providers are deciding how quick this patient needs a bed. Then that's communicated out. We put it on our bed board so everyone knows. And then we have a wait list. My team is monitoring that wait list, checking back in with the sites. Hey, where are we at? We still have this patient that's sitting at home that needs a bed. Bringing that communication full circle, that's been super powerful for our network.
Those things that you mentioned there are really going to be helpful to a lot of listeners here. Not only the prioritization, the triaging, but I also like your processes. We work with a lot of healthcare systems here at Vizient. If I can't take them at my specific facility, maybe one of my other facilities within my healthcare system can. That is great.
I don't know why we struggle with that, but it's something that is from our standpoint, we definitely push on. And you'd be surprised how many times it does work out well. The other thing I would suggest is when we created that triage process is definitely engaging your physician leaders, your medical directors, emergency department. We have a medical director for our transfer center that had some strong input into the levels and how we would group those patients that needed to be placed timely, making sure everybody understands workflow and communicating, and also documented in our EMR. It's worked out well for us.
And I would guess by involving me as a physician in the design and coming up with the triaging levels, you probably get buy-in too, because I as a physician helped create this tool.
100%. That's a big key in transfer is pulling in your physicians and getting them to understand the processes and the needs. Because again, they don't know. They're busy. They're busy seeing patients. They're not involved in the weeds of the placements. Bringing more awareness to Throughput has been impactful for our network. And everybody has the same goal. We're trying to get patients discharged so patients can come in. And then what are those barriers It starts at the inpatient unit, at the discharge piece of an inpatient unit. You cannot do anything with the emergency departments, the PACUs, the direct admits until you have patients discharged. You would be amazed at the things that you learn when you start having those open conversations, bringing people into a room and saying, okay, tell us what the barriers are. They'll tell you all kinds of things that you didn't even know was happening. Didn't take me long to realize that I can't get someone to bed if I can't get them discharged from it. So we definitely have done a lot of work over the past 3 or 4 years and digging deep on how can we start providing support to our bedside nurses to get patients discharged.
That's a great example there of going to the front line and talking to them. This is a barrier. What do we need to do to address that? Instead of me not being at the front line, trying to come up with an innovative way of handling that barrier, you're really getting it from that front line.
Yeah. And again, how can we identify patients that are ready to go home, that can go home early the next day so we can pre-plan and get a game plan for these patients so we can get them out by 9 a.m. tomorrow. When your EDs start getting busy and your surgeries start coming out, you have a place to place your patients. It's not perfect, and we struggle still because you're going to run into roadblocks daily. That's one thing I've learned in this role. Each building has their own set of nuances that are their barriers. I love this work. It's very enlightening to learn the ins and outs of your buildings and operations.
You've made me, again, have another flashback and something that we constantly hear. If you went to one facility, you went to one facility. Everyone kind of has a different culture and a different way things are working. Something that a member recently brought up when it comes to transfers, the way that they're carried out really depends on the day, depends on the nurse, depends on the physician who's doing that transfer. There was really no standardized way within their system to address transfers. Have you seen anything like that?
It goes back to developing the protocols, developing the processes, developing the policies, but then educating your teams on it. What I've seen happen is, and we see it still, where you may have new nurses that were onboarded, didn't get that memo of what that process looks like. And so they're basing it off of their experience at other facilities. It has to be a topic that's discussed during orientation, because if you work on an ICU or a PCU, it's a step down process. Some go home from those areas, but it's not as common as your med-surg unit. Doing the annual learnings, you've got to bring that education to the bedside. We were just having this conversation in our Throughput meeting last week, and I said, we have done everything as an executive group or a leadership group to try to break down barriers, right? So now we're at the level to where we have to have that bedside engagement and the importance of discharging. The longer your patients stay in the hospital, the more risk they are for harm. So educating and developing policies and protocols that support that initiative and continuously educating. You cannot put the brakes on education. You have to keep educating your teams.
I love that you do that education. So often you'll see hospitals or facilities send out a new policy. The physicians say, yes, I've read the policy, and that's really it. This way, you've got the policy, yes, but you've also got that ongoing education, whether it's annually or whenever the policy is updated. That piece is key.
You have to evaluate your service. If it's complex and it's hard, then your nurses aren't going to follow it, right? Like they're busy. They need it to be easy. I tell my staff all the time, what's our easy button? How can we cut out some of the meat to be able to hit the easy button? When you're in an ER and you're fast paced and you're moving and you need to get patients transferred, what's that easy button? What does that look like? How do you still have all the information that you need so you're not compromising patient care? I keep pushing my teams on, and they probably get tired of me saying that, but I'm like, what's the easy button? You got to make the process easy for your staff.
And that sticks. That's memorable. I can tell you, I'm going to remember that now. What's the easy button, even going through my work now? I love it. Thank you, Sharon, for joining us today and sharing your insights when it comes to the transfer process. And thanks to you, our listeners. Please join us for more knowledge on the go. Subscribe today, like us, and send us your comments at picollaboratives@vizientinc.com.